What are the different kinds of therapies?
There are literally hundreds and hundreds of different types of psychotherapies, but among the major ones, there's probably about a dozen or so. And I myself have been trained in 7 different therapies, some of which kind of fall under the same umbrella heading. So I do psychodynamic therapy, which is kind of like Freudian light, psychoanalysis light. I don't take Freud literally. I do think that there's a lot of merit to some of the things he says, mostly about people not really being aware of what's going on underneath, people engaging in defense mechanisms to protect themselves from anxiety. And in my practice, I work at trying to bring the unconscious to the conscious. I help people to be able to confront things that they are afraid to deal with, or that cause them anxiety, or that they've been avoiding, and they may have pushed into the unconscious. Just means that they're not really aware of it. Okay, it's processing that's going on mentally that they're not really aware of, and I deal with that. But I'm also a humanist, or a Rogerian, or client-centered, meaning that I don't direct therapy. I work with the client. We look at what is most important for them. I don't tell them that this is what we're going to do this week. I let them determine that, but I work with them. I ask the right questions. I try to help, bring up issues that they've brought up in the past, and see, is this something that they want to deal with? But again, I don't tell them what's important. I work with them to determine what's most important. I also do what's called emotion-focused therapy, which is really powerful. It's very potent. It's kind of a combination of different types of therapy, but instead of just talking about your issues, you're really experiencing them emotionally, and that's where real change occurs in most cases. I also do interpersonal psychotherapy, meaning I look at the impact that one person has on others, and as well as the impact that other people have on that person that they may not have been aware of. It helps them really deal with people in their life in a much more adaptive manner. So these are just some of the different types of therapies. And what most people say is that they practice cognitive behavioral therapy because it is one of the few that's actually covered by a lot of insurance companies. It's quite concrete. It's specific. It says, what is the problem? Let's find it. Let's delve deeper. Let's bring up some issues you may not have been aware of, and let's work specifically at these issues. Have some really, short-term goals in mind. Help people really understand their thought processes better. Help them understand how they may be distorting their experiences better. And I've been trained in that as well. And it works for certain people. And you know what? The most important thing is, every therapy works differently for different people. Not everyone's a good match for different types of therapies. So it's the therapist's job to see, can the client work with these tools? Can they work with these types of philosophies and practices?